Welcome everyone as they're joining. It's quite a technical effort to put this together, so a huge thanks to the WHO team. Participants will have received guidance related to the translation options, so hopefully that is well set up. The interpretation details were given in advance, and the team have uploaded them there. We've got quite a full agenda over the next 2 hours for this online general meeting of the Alliance for Transformative Action on Climate and Health. This network is here for you. The strength of the initiative relates to its members. We hope to hear from very many voices this morning. We'll have an opportunity to hear a bit more about who each of us are as we introduce ourselves. Please feel free to take a moment to introduce yourselves in the chat. There'll be all sorts of side connections between different ATACH members joining today and colleagues in a whole variety of countries and organizations. This is a partnership. The idea is that we pick up things which are of interest, of relevance from what others are doing. It's a global network, so there's a lot to share. My name is Leonard Ted. I work for the UK Government Foreign, Commonwealth and Development Office. We are co-conveners of the ATACH partnership. And I'm only here to moderate and facilitate and try and keep the agenda to time. So I think the agenda was shared and it was up on the screen just a moment ago. We'll pass first to the World Health Organization, to Dr. Rüdiger Krech, who leads the Environment and Climate Change, One Health and Migration work as the director for those areas in WHO. Over to you, Rüdiger.
Thank you so much, and a very good morning, colleagues, friends, members of the steering groups. Thank you for joining today and for your continued leadership in driving the climate and health agenda at a moment when global action is ever more urgent. Over the last years, ATACH has been providing us a key global platform to deliver a critical and ambitious mandate to protect and promote health by building climate resilient and low-carbon sustainable health systems and leveraging the health argument to drive healthy climate action in other sectors. ATACH's growth tells us a powerful story. Country membership has doubled since COP26, from about 50 to over 100 countries, with total membership surpassing 200 countries and partners. This is a clear signal of ATACH's relevance and value. The recent evaluation of ATACH, which will be presented today, gives us an important opportunity for reflection and refinement amid an increasingly challenging global landscape. The evaluation tells us that the alliance model and operations we have built are the right ones, focusing on advocacy, alignment, knowledge sharing, financing, and monitoring. It also confirms what many of us see every day. ATACH delivers exceptional value for money. With a lean secretariat and very limited resources, ATACH mobilizes political commitment, produces high-quality technical work, and convenes a uniquely broad and active community focused on country implementation. The recommendations of the evaluation now give us clear, actionable options to consider to ensure that ATACH optimally adapts to the challenges of our time and fully meets its potential to support countries on climate change and health. Particularly, the evaluation underscores a strong demand for countries for capacity building, access to finance, and stronger monitoring and accountability. These areas will be central to ATACH's next phase. The ATACH evaluation also reminds us that ATACH's convening and catalytic role is crucial at all levels, amid a complex global landscape with a growing number of initiatives and actors. There is a clear need to advance the regionalization of ATACH, leveraging WHO's presence and existing regional mechanisms, and ensuring deeper engagement of constituencies to strengthen even more the match-making role that ATACH has been given. While ATACH is not an implementing or funding mechanism, we can strengthen the alliance's catalytic role, helping countries prioritize actions, navigate finance, and connect with partners who can support implementation. WHO is committed to the ATACH not only as its secretariat and key convening role, but also as a technical partner. In this context, I'm also thrilled to share the news that WHO obtained official accreditation to the Green Climate Fund last week. This opens an important avenue for countries to access finance for climate and health implementation with WHO's support. WHO's accreditation catalyzes a paradigm shift. It embeds health resilience and equity into climate finance to help protect communities from the health impacts of climate change and build a resilient and low-carbon health system. I'm delighted to see so many of you connected today to discuss and discover the progress made by ATACH and its next steps. An alliance is only as strong as its members. Your active and continued engagement is crucial to shape ATACH's direction and maintain the global momentum we have worked so hard to build. As a WHO-hosted global platform, ATACH is set to play a critical role in this process, and I look forward to the next steps with you all. And with this, I thank you, and back over to you. Thank you.
Thanks, Rudiger. That's really fantastic news about the Green Climate Fund.
Oh, yes, it is. We're really thrilled about this.
New partnerships.
It took us 10 years to get there.
Oh, my goodness. And what that can then mean going forward. Thank you. So passing to Charlotte. Charlotte's the head of department for the Human Development Department in the Global Health area of the UK Government's Foreign Commonwealth and Development Office. Over to you, Charlotte.
Thanks, Leonard. Well, welcome everyone. I'm delighted to join you. This is my first time here at the ATACH General Meeting. It's wonderful to see so many of us gathered and eager to deepen our partnership to build climate resilient and sustainable health systems and collaborate across sectors. We're here because we share a conviction that climate change poses a serious and direct threat to health and to the social, economic, and environmental determinants that undermine our global health security and systems and individual and community health. We also share a goal, universal health coverage, which is about building strong, equitable, sustainable and resilient health systems, and it's vital for addressing climate change. But whilst part of the solution, climate change risks our ability to reach our universal health coverage goals. So estimates suggest that climate-related disasters have increased 80% in the last 40 years. In the last 30 years, floods have killed over 206,000 people and affected 2.6 billion globally. Heat-related deaths have soared 23% since the 1990s. That's about 550,000 a year. You don't need convincing. These events and the increasing health burdens are only set to grow at an accelerated pace. We need to raise our voices to turbocharge climate action and emission reduction, leading by example, reducing emissions from our own sector, and we need to rapidly invest in resilience to the impacts. The UNDRR claims that for every $1 spent on natural disasters, risk reduction can save up to $6 in recovery and response costs. That's why investing in climate resilient and sustainable health systems is a priority for the UK and fundamental to achieving many of our health objectives, both at home in the UK and overseas. And that's why this alliance is absolutely essential. I'd like to highlight the recent independent evaluation, which has already been mentioned, which describes ATACH as a credible, high-value partnership. That's a remarkable achievement for a platform that's grown rapidly since COP26. It's grown rapidly to include 105 countries and over 100 partner agencies. When we were conceiving ATACH with WHO and partners, we didn't ever imagine where we would be today. In a changing world with complex interdependencies, it's alliances like this that help us to grow, collaborate, and mutually support progress. I'm looking forward to hearing from Brazil on your plans for building upon COP30 and the Belém Health Action Plan, and opportunities to maintain and boost global momentum to drive implementation. I'm looking forward to hearing from France on G7 presidency plans, including ATACH Strategic High-Level Meeting, and Turkey on their priorities for COP31 and any opportunities there are for health and ensuring the continuity of Brazil's efforts. Whilst global frameworks give momentum and direction, real progress has got to be at the country and community level, and that's where the magic happens. ATACH's value lies in the ability to bring together a diverse community, sharing best practice, growing the evidence base and global expertise, and aligning efforts to meet the scale of the challenge and harness opportunities. Today's meeting provides an opportunity to take stock of ATACH's achievements in 2025. Importantly, we will be looking ahead to priorities for 2026. Keen to hear from you, the members, on the future agenda, our ways of working, and our priorities. To poach the Brazilian partners term, we must embrace the mutirão, if I said that right, which means the spirit of collective effort and cooperative action. In the face of climate change, I am sure that you're all as keen as I am to continue to work together to improve population health and well-being for our prosperous and our secure futures. Thank you, and I look forward to some very fruitful discussions.
Thank you, Charlotte. And so thank you, Charlotte and Rudiger, for your opening remarks. So as I said, we're hearing from many voices this morning. The next segment is to hear a bit more from the government of France, Bertrand Millet, and from the government of Turkey around some of the opportunities that arise from the G7, the French presidency this year, and also COP31 later in the year. Can I pass to you, Bertrand?
Sure. Thank you very much, Leonard. And very happy to see so many people connected at that time. Good morning and good afternoon and good evening to all ATACH members. You may know that we are just in the last line to prepare as well the One Health Summit that will take place next Tuesday in Lyon, in France. And I'm quite busy, so sorry that I won't be able to stay the whole meeting, but Valentine, my colleague who is very much in charge of health on climate issues, we will stay connected the whole day. And thank you for organizing this meeting and for giving us the floor. I will briefly present the ATACH high-level strategic meeting that will take place on the 25th of June at the French Ministry of Health in Paris. To say that this event is hosted by the World Health Organization, of course, the ATACH Secretariat and the French Ministry of Health under the auspices of the French G7 presidency. It will bring together G7 representatives from ministries of health and environment, ATACH champion ministers, and key partners from international organizations, civil society, philanthropic organizations, and the private sector. The aim of the meeting is to take stock of current progress, renew the political commitment, and accelerate concrete action on climate and health with a particular focus on implementation at country level. Over the past few years, political momentum around climate and health has grown significantly, with a number of important commitments emerging from the global initiatives. These include initiatives launched during recent COP presidencies, the creation of ATACH during COP26, of course, the COP28 Health Declaration, the World Health Assembly resolution, on climate change and health, the WHO Global Plan of Action on Climate and Health, and lastly, the BELAM Action Plan at COP30 in last November that we were very proud to endorse. In this context, ATACH play a key role as a platform to translate these commitments into concrete implementation. France is proud to take part in this global agenda through the support of ATACH and WHO, the BELAM Action Plan, and by putting this agenda as a priority of our G7 presidency this year. 6 months before the COP31 and following the G7 Leaders Summit, this high-level strategic meeting has 4 main objectives. First, to renew high-level political commitment from the health sector to build climate resilient and low-carbon sustainable health systems, and to gather strategic advice on priorities for further action. Second, to take stock of the most meaningful and successful example of implementation of climate action at the health system level. Third, to identify country needs and priorities for ATACH, as well as the opportunities and challenges for advancing implementation at national level. And fourth, to strengthen collaboration with other sectors, particularly the environment sectors, in order to promote a health and in all policies approach and better integrate health consideration into climate discussions. The meeting will begin with a high-level opening with remarks from our French Minister Stéphanie Rist, followed by a session reviewing ATACH progress to date and priorities going forward. This discussion will cover several key themes in link with ATACH priorities, including first, financing the health commitments on climate resilient and low-carbon health systems. 2, climate resilient health systems, low-carbon sustainable health systems, supply chains, and climate action and nutrition. In the afternoon, discussions will continue with additional high-level segments on accelerating progress towards climate resilient and low-carbon health systems, including supply chains and on strengthening cross-sectoral collaboration for health. One of the key expected outcomes of the meeting is the Together for ATACH declaration, which aims to reinforce collective political commitment and provide a common direction for further action. Overall, the meeting represents an important moment to align priorities, share experiences, and strengthen cooperation in order to accelerate the implementation of climate and health commitments at country level. We will also organize together with ATACH a side event on the morning of the 9th of April as part of the One Health Festivals and G7 Health Walk. This hybrid event will focus on resilient and low-carbon health systems as a practical One Health solution, and we welcome all ATACH members to take part in this event. The registration link can be found on the ATACH website. It will be both in-person and remote meeting. Looking forward to these 2 events, and I will be happy to answer any questions you may have, or to leave Valentine answer to any questions you may have. Thank you very much, and once again, very happy to be with you this morning and to support ATACH.
Merci, Bertrand. Thank you. That's really fantastic. There's a lot of very specific opportunity there, and the attention given on this agenda through the French presidency really helps the overall agenda. Can I please pass to Dr. Gül Serim from the Republic of Turkey's Ministry of Health on thoughts as relates to COP31 and anything else to cover? Over to you.
Thank you. Distinguished participants, climate change is no longer solely an environmental concern. It is one of the defining public health challenge of our time, as also recognized by World Health Organization. Its impacts ranging from health-related mortality to food insecurity and the shape of the vector-borne diseases are already being felt across the whole region, with disproportionate effect on the most vulnerable. Addressing this complex nexus requires not only strong multilateralism, but also more agile and complementary forms of cooperation. In this regard, ATACH plays a critical and timely role as an active member of the ATACH. Turkey highly values the platform's efforts to foster collaboration, share knowledge, and accelerate the development of climate-resilient and low-carbon health systems. We reiterate our strong collaboration for ATACH mission and ongoing work, and we stand ready to contribute further to its collective objectives. Turkey also acknowledge the evolving landscape of the global governance, including what is often referred to as two-speed multilateralism. We see value in both tract, inclusiveness and legitimacy of the UN system, alongside the dynamism of coalition and voluntary initiatives that can accelerate the process. These approaches should be mutually reinforcing, particularly in advancing the climate and health agenda, an area where ATACH role is especially instrumental. Looking ahead to COP31, Turkey will host in Antalya in November 2026. We see a unique opportunity to further elevate health within the climate negotiations. Building on the momentum recent COPs, we are committed to ensuring that the health dimension is more systematically integrated into climate policies and discussions. In this context, the continuation of the Health Day, first launched at the COP28, will be a key priority for us. Preparations are ongoing to ensure that this thematic day is impactful, inclusiveness, and result-oriented. We aim to make Health Day a platform that brings all together policymakers, including ministers, experts, and relevant stakeholders, to deliver concrete and actionable outcomes. We attach great importance to partnership in this process. Turkey remains fully open to close cooperation with ATACH members, WHO, international organizations, civil society, and other stakeholders to shape and deliver a strong and meaningful Health Day agenda. In particular, we are looking in coordination with Brazil and Australia to ensure continuity and coherence across COP process. In this context, we are planning to co-organize together with Brazil a high-level side event on climate change and health during the upcoming 79th World Health Assembly. This event will provide a valuable opportunity to strengthen high-level dialogue, exchange best practices and experiences, and advance collective efforts to further integrate health consideration into global climate actions. Furthermore, Turkey supports the effective implementation of the Belém Health Action Plan adopted at COP30. We consider this action plan a critical framework for translating political commitments into tangible actions, particularly in strengthening climate resilience and low-carbon health systems. In addition, within the scope of the COP31, the organization of a high-level meeting of ministers of health is among the ideas under consideration. Should this initiative will be further developed and formalized, we will be pleased to share more detailed information with you. In conclusion, as we move from COP30 to COP31, Turkey stands ready to play an active, constructive, and bridging role, bringing together different actors, approaches, and the level of the ambition. Our objective is clear: to ensure that health is firmly anchored at the heart of the global climate agenda, and that our collective efforts deliver real benefit for people and communities worldwide. We look forward to welcoming you in Antalya, and we thank you for inviting us to this distinguished event. I thank you.
Thank you so much, Dr. Serene. That's really fantastic, really great presentation of some of the opportunities and particularly the work with Brazil and, of course, Australia, with one initiative mainly coming from the COP 2 years ago was to try to make sure the presidency passed from one to the other in a way that meant that successive COPs built on the initiatives, and from the Belém Health Action Plan, how that feeds into your work this year. That was really great to hear, in the initiative at the World Health Assembly imminently. So with thanks to that, I wonder if there are any questions from any participants. Maybe do feel free to put questions in the chat. I'm sure that will be tracked. We have a slot for open Q&A in the agenda. So if there's nothing really burning, if I can't see any hands, then I will pass to the Secretariat to give an update, which takes stock of all of the work that's happened out of the WHO Secretariat. So Dr. Elena Zotova at the ATACH Secretariat, Elena Villalobos, and the Secretariat lead, and Dr. Amy Savage, over to you.
Thank you, Leonard. So I'm Dr. Elena Zotova. I will start with the first part of the update before handing over to my colleagues. So just to set the scene a little bit, and as the first update, I'm pleased to present the results of the joint evaluation of ATACH, which has recently concluded. So this was a joint evaluation led by an external consultancy, Cambridge Economic Policy Associates, in collaboration with our Secretariat between December last year and February this year. So the objectives were to first assess the effectiveness of the new ATACH structure and governance, which, as you know, has been launched at the beginning of last year, to identify lessons of what has worked well and what could be improved going forward, and also to formulate recommendations to optimize ATACH operations so that the Alliance properly delivers on its objectives. How the evaluation was conducted: first, there was a survey distributed to ATACH members in 3 languages. We also conducted some interviews and focus group discussions, mainly led by the external partner, and also a document review was conducted. Next slide, please. So as some of the overarching results, and sorry, I forgot to mention, the evaluation report is published online. My colleague will put a link in the chat in a moment, and you have the QR code as well to access it from your phone, but the link will be in the chat for your reference. Next slide, please. So again, the main results, overall, the evaluation has recognized that ATACH has catalyzed significant global achievements on climate and health. It is widely viewed as a credible and high-value partnership. And it also recognizes that the Secretariat is quite lean and has limited resources, thereby representing strong value for money. The ATACH operational mechanisms, so the task teams, technical meetings, and others, were also seen as largely supporting member engagement and country implementation. Next slide, please. In terms of the strongest progress made by ATACH, it was seen to be in advocacy and agenda setting, as well as in terms of facilitating partnerships and knowledge brokering. And the biggest opportunities for improvement identified were pertaining to ATACH's work to support accessing finance, supporting country implementation, and also accountability and tracking of commitments, as well as tracking of progress towards those. So the evaluation also recognized that moving forward, considering the increasingly crowded and constrained global context, the global expectations for ATACH should align with the available resources, and it will be important for ATACH to ring-fence its priorities and activities based on its comparative advantage and resources. Next slide, please. So these are the main recommendations of the evaluation. Again, these are further detailed in the report. Apart from what I've mentioned so far, the evaluation also found a need to further leverage WHO's convening power at all levels, including through regional convenings, and also to, here in number 5, to strengthen communications around how the ATACH works and how members can engage to really maximize the engagement on this platform. Next slide, please. So as the next steps, our Secretariat is taking forward the recommendations deemed feasible from the evaluation for the upcoming work plan of the Alliance. And also, an operational strategy for ATACH is being developed in collaboration with an external consultant, and this will be presented later today. And the aim of this operational strategy is basically considering the changing global landscape. What are some of those different scenarios for ATACH activities that can ensure that the ATACH properly delivers the best value it can deliver for countries? So that's it for me, and over to Elena Villalobos-Prats, the ATACH Secretariat lead now. Thank you.
Thank you very much, Lena. Can I go to the next slide? Click again, please. So basically, I will not go into details into this. I just wanted to highlight that the ATACH is everybody, and I'm a little bit touched by the amount of participants and organizations and countries that are connected today, just trying to get an update on what is happening and which are the next steps for ATACH. I think we all together had a great evolution. And I wanted to also thank the invaluable support from FCDO and also Spain as the key donors that have been supporting the ATACH over many years. So next slide, please. As Lena mentioned, and it's been shared in the chat, basically we have developed an ATACH progress report. You can have a look at it. There are lots of information, including on everything that is happening, the outputs of the different task teams, basically information on communications, technical products, commitments, and progress made today. Next slide. This is part of the information that you can find there. I thought it is interesting to see basically the percentage of each of the WHO region countries that are part of the ATACH, and something that is included in the evaluation and that is going to be a priority for us going forward is to make sure that the ATACH gets closer to countries. So basically, that's why we are discussing with our regional colleagues in all of WHO offices to make sure that we strengthen the function and the capacity that they have to really be closer to each of the countries that are represented in the ATACH in the regions. And that's what we call the regionalization of the ATACH. Next slide. This is also included. You will see all of the outputs and the technical products that have been developed. Next slide. Next slide, please. Okay, this is a long slide. Basically, there is a lot of information that we also gather while doing the evaluation from the ATACH, and basically, we heard from countries on their priorities and needs. Next slide. With this information, we try to make sure that we are setting the ATACH and driving the ATACH based on what countries are needing. So basically, we ask countries which are the functions and the activities that the ATACH is doing and that should be strengthened. Basically, which are the functions that are more relevant to you. So countries were telling us they want more capacity building and training. They want more real opportunities to access finance and to understand how they can do that. They really appreciate networking, collaboration, engagement, and they want us to strengthen this matchmaking function that the ATACH basically is doing. And they think that this matchmaking is great at global level, but again, they want it closer to them. They want it at country level. So they want to know which are the partners, they want to know which are the technical opportunities that these partners bring to the table, financial opportunities, and they really want to see this ATACH being replicated at all levels. And then, of course, continuing developing and facilitating access to technical guidance and tools. Next slide. We also ask countries which are the technical topics and priority topics that they need more. And this is just slide summarizing those topics per function included in the WHO operational framework for building climate resilient health systems. So this is more or less a high-level summary of the priorities, so for you to understand where those technical priorities are included. So the key priorities: leadership and governance, then followed by financing, integrated climate and health monitoring and also tracking. So it's everything related to health information systems, and then health workforce and capacity. And of course, everything related to infrastructure, technologies, and supply chain and healthcare facilities. Next slide. So when you look in detail to each of these priorities, we see that under health information systems and integrated monitoring, greenhouse gas emissions, and progress tracking, the key priority is really on integrated climate and health surveillance and climate-informed health early warning systems. When you look to governance, it's really policy development and decision-making. Next slide. Under infrastructure, technologies, and supply chain, the key priority by countries is climate resilient and environmentally sustainable healthcare facilities. And when you look at health workforce, it is capacity building and training. For finance, is really this priority to know more about which are the opportunities and how to access those. Next slide. So listening to all this, we decided that the ATACH should evolve, and basically that all of the operational mechanisms should be around more capacity building and more technical priorities, so that we were able to accompany countries when they are implementing the different priorities on a closer manner, and basically being able to learn from them, to hear from them when they are advancing these technical priorities. That's why now we are proposing the creation of 5 communities of practice, thematic communities of practice, that will be able to decide which are the task team, meaning specific outputs, tools, training packages, technical guidance that they will be developing, and also decide which are the technical meetings that they will implement. So the expression of interest for these 5 thematic communities of practice, task teams, and technical meetings will be launched hopefully this week. Next slide. And again, this is an opportunity for all of the partners, for all of the countries to come together and tell us which are the areas that you are interested in leading. So I will not go into details because you've seen this several times, but again, now we have these thematic communities of practice as the key structure that will basically allow us to move with the different operational mechanisms under the ATACH. Next slide. We developed different criteria. We will be sharing more information on how these communities of practice were created, the roles, the governance mechanism. Next slide. And these are the 5 communities of practice with the rationale on why we've created this one. So there is one on governance, assessments, and plans. There is a lot about multi-sectoral collaboration, being able to assess emissions of health systems, vulnerability and adaptation at country level, and also how to develop decarbonization plans or health national adaptation plans, finance. And countries want to be able to also get training on how to prepare, for example, project proposals. We mentioned before that as WHO now we have increased opportunities to support countries because we just got accredited to the Green Climate Fund. We are also accredited to the Adaptation Fund and the Loss and Damage Fund. So basically, we hope that all of the partners will come together to really support countries to access the different opportunities that there are out there. There is one on integrated climate and health surveillance and early warning systems, including heat, one on climate resilient and environmentally sustainable healthcare facilities, and the last one on nutrition, climate, and health. Next slide, please. We are now coordinating with the leads for the different task teams to know which are the concrete plans for them to advance their work this year. So there will be some task teams that will be continuing their operations, like, for example, the climate and health indicators. Others may be dismantled. And then we are suggesting the creation of 5 new task teams. Again, we are under discussion. Maybe some of these are going to be merged, but there is going to be one on gender and equity, blended finance, role of private sector, standard for climate resilient and low carbon sustainable healthcare facilities, and then another one on mapping of capacity building needs of different types of actors. Next slide. Many opportunities for technical meetings. I saw in the chat that there is also a suggestion for additional topics. This operational mechanism is quite open. So under certain criteria,
I don't know if I'm the only person.
Sorry, I hear some. Basically, we will be able to create more meetings. Next slide. Basically, this is the summary of priorities. The operational strategy for the ATACH. I will not go regionalization, the communities of practice, operationalize the ATACH champions figure, support the implementation of the Belém Health Action Plan by expanding and tracking progress on its implementation. And for this, we will add a few indicators under the ATACH community of practice, online community of practice that is available to everybody. And we are also going to track the implementation of the ICANN, strengthen the ATACH matchmaking function, strengthen opportunities for capacity building, and you will hear from my colleague, Dr. Savage, later. And then also something that I think is very important is that countries are requesting us to help them understand how the different commitments and priorities that they are to implement are linked to each other, and basically support them on understanding what does it mean for them if, for example, they are advancing the implementation of climate-informed health surveillance, how this is linked to the different priorities and commitments. So we'll be developing a mapping, and we are working with our regional colleagues to do this. Next slide. Next slide. This is for Amy to continue. Thank you very much.
Thanks so much, Elena. Just briefly, we wanted to highlight that we really recognize that capacity building is a top priority for our ATACH country members particularly. It has been highlighted as a priority, as Elena showed in the evaluation, also in other feedback mechanisms that we have for the ATACH. So this is a function that we will be really focusing on strengthening over the coming months. One of the first steps is what Elena mentioned about the new thematic ops, part of the communities of practice. Part of their role will be to strengthen capacity building or support capacity building under each of these technical areas. We're also developing an ATACH capacity building strategy, which we will share hopefully very shortly. And the first step will be an attached capacity building page on the online community of practice, which will be launched very soon. So we have some activities to really strengthen attached capacity building in the works. Next slide, please. But we wanted to start with getting a little bit of feedback from you. So this is a Slido survey, which you can access with the QR code or follow the instructions on the slide here. And we would like to understand, particularly from the country members of ATACH, which of these proposed elements, or there's also an open text, so something else that you would like to share with us for ATACH supported capacity building would be the most useful in your country context. So we're looking at developing a competency framework for various climate change and health roles, which would lay out the different competencies that need to be built to build the expertise in different areas of work for climate change and health. We'd also like to know if tools and support for developing structured learning pathways at country level would be useful. So looking at the competencies and then developing a path or a roadmap to reach high levels of competency for different roles, if that would be something that would be useful. Then, of course, in-country, in-person workshops, peer-to-peer learning opportunities, virtual implementation clinics, which would be a little bit more informal in a sense, where you would be able to bring questions or challenges that you're having and have experts online that would be able to provide some immediate support or point you in the right direction. and then regional or global in-person meetings or trainings. So you can select as many options as would be relevant in your context, and we would really love to hear from you about anything related to what you would like to see for capacity building under the ATACH. Thank you.
Okay, so that's a really full presentation from the Secretariat. I mean, I would really sort of direct people to look in detail at the outline of the task teams and the communities of practice, the opportunities around governance entry points, finance, the data and early warning systems and the breadth of that, on climate resilient health facilities, and our opportunities on nutrition and climate and health. It's really trying to build groupings of people who are really engaged in that area to exchange, to network, and to communicate outputs of work. Hopefully the Slido, the QR code is there. I just checked it. That's still working. And the other thing I just wanted to mention in the inter-segment portion is just to welcome everyone who's joined. Lots have put their intros in the chat, and we've people from as broad a set of geographies as the Cook Islands, Timor-Leste, Bangladesh, a colleague from Japan, Nepal, Sri Lanka, also Nigeria, Uganda, elsewhere in the Africa region. So it's a very diverse and very geographically spread group, over 200 participants. So there's a lot to share, and if people see in the chat colleagues who are not known to them, but working in similar areas or in linked ministries, please do use the chat as a way to network. So we're moving now to the next portion, which is to understand a bit more about some of the outputs of some of the more established task teams on smart buys, on some of the high VFM actions on the climate and health intersection, on measuring greenhouse gas emissions in health systems, and somewhat linked to that, how health supply chains can be decarbonized. So let me first pass to Jackie Melenda, consultant economist with the World Bank. Over to you, Jackie.
Thank you, Leonard. I hope everybody can hear me, and thank you for asking for us to provide this update. I wanted to talk about, I've been asked to talk about the Smart Buys report, which we published at COP30, and it's a report looking at, we were originally asked to look at best buys, but as you'll see in a moment, we've slightly pivoted to smart buys to look specifically at high value actions for health sector adaptation. Next slide, please. So I don't need to tell you why this matters now. We all know that the cost of inaction to health is going to escalate between over the next century. We know that countries are asking for adaptation finance and are asking to invest in interventions to help them adapt to climate change in relation to health systems, and they want to know where they should put where the money should be going, where it's going to be the greatest health and economic return. We also know that we should be focusing very much on action, not just ambition. So the Bellum Health Action Plan really is about creating that demand for practical, evidence-based measures that can be implemented at country level. So this Smart Buys report matters because it helps to turn that commitment in climate and health adaptation into an investable health sector agenda. We've identified evaluated actions that are specifically designed to protect people, to keep services running, and which have demonstrated in the context in which they've been evaluated to show value for money. Next slide, please. So what we did a structured review and did our own value analysis of the actions that we identified. So we did a review of nearly 6,000 studies, well, over 6,000 studies, plus sourced from peer-reviewed literature and supplementary sources. We selected, on the back of a systematic review of those studies, we selected 15 potential studies for detailed review, and 10 of those 15 studies, we selected 10 candidate actions. And supported by a network of experts, some of whom are on the call today, we selected 8 final actions for inclusion in the report. And the value analysis that we did was deliberately broad. We did a social cost benefit analysis, which included not just those benefits that are easy to monetize or relatively easy to put a monetary value to. We also included those softer outcomes which are more difficult to measure and more difficult to put a monetary value to. We wanted to give as broad as a value analysis as we could, so as to identify which actions were promising and which were specifically potentially included in local country plan, potential for inclusion in local country plans. We also separately worked with the DCP3 team, now DCP4, to look at all the interventions that had previously been identified as high value interventions as part of essential health benefits package that already been proven to be cost effective, but might be particularly relevant in the context of the additional risk that climate poses for particular health conditions. And so that work also complements very well the kind of actions that we looked at, which were about delivery systems, essentially. Now, I just wanted to caution this. We didn't come out with a ranking of interventions. We didn't rank the 8 to say which one was better than another. And the reason for that is that they're actually each very different. They each work differently in different contexts. And the evaluations that were done each measured slightly different things. So we just literally presented, is this worth doing? Does it provide a net benefit? Yes. Okay, we'll include it in those list of smart actions. Next slide, please. Smart buys. So the 8 action areas that we identified where we were able to demonstrate that benefits exceeded costs included heat action plans, integrated surveillance and early warning systems, climate resilient health infrastructure. We looked at supply chains, medical supply chains particularly, and drone-based medical supply chains in the right context provides net benefits. We looked at also at community health workers and climate health education and the benefits of doing that. We looked at the use of text-based telehealth services in the context of particularly of stressful situations in times of environmental disasters. We looked at the provision of specialist mental health services in the context of climate change, and we looked at vector distribution and ecology, and particularly around mosquito vector control. As I say, we also went through the DCP3 interventions and showed that things like nutrition, interventions relating to maternal and newborn health, interventions relating to infectious disease control and vaccination programs, mental health. These are really climate relevant interventions that should be prioritized highly in those countries where developing universal health coverage, where they have climate related health risks. But really importantly, we were trying to stress that the adaptation needs to be built in with essential services and UHC pathways and not treated as a separate agenda. This integration is crucial. Next slide, please. Just to highlight one or two of the findings, you can see that from the work that we were able to do on the heat action plans, we used a study from Ahmedabad, and we were able to demonstrate on the basis of the information provided a huge return on investment of over 100 to 1. So for every £1 invested or $1 invested, you would see $100 return, and that's predominantly in terms of averted mortality. We didn't include the value of morbidity or improved health itself. So these are really quite significant high value findings. So where heat action plans are implemented effectively in the context of extreme heat, they can be really, really cost beneficial. Other examples, I'm not going to go through all of them because we don't have time, but we can see that the work that was done in the Caribbean, once you put a value analysis to that, you can see a very significant set of return on investment from investing in resilient infrastructure. Similarly, around mosquito vector control. The community-led climate health education programs, a little bit more difficult given the evaluation studies reported outcomes, but we were able to demonstrate reductions in hospitalizations that resulted in and then we used the Karachi heat program, and that demonstrated, just on the basis of all-cause hospitalization reduction, a 3-to-1 return. That didn't count in mortality or morbidity effects. So these all looked at slightly different ways of monetizing the benefits, which is why they're not really comparable, but they all demonstrated a net positive return. Next slide, please. Similarly, this slide shows the results for the others that we looked at, again, ranging from avoided hospitalizations, estimated impact on health, estimated impact on mental health, and all showed positive return on investment. Next slide, please. So what do these 8 smart buys mean for countries? Well, it's a start of a journey. There's more to do, certainly more evaluations to be done, more consistency is needed across these evaluations in order for us to start comparing them. But really important lesson from this was context matters. Context matters hugely. So the idea is to use these smart buys as a menu rather than a template. So country vulnerability and health assessments, countries preparing their health and national adaptation plans might see these as a list of where to look for candidate actions that might be included in local plans. But the work needs to be done to think through, are they relevant for that local context, and what priority should be given to them given those local contexts. The other really big important message is to integrate the adaptation actions to the main part of the health system plan, and that includes essential health benefits package development. The links to DCP3 show there's a lot of evidence already of what would work, what needs higher priority, what's cost effective in addressing the additional risks to health that come from climate change. And then really importantly, making sure that those enabling conditions are in place. So none of these actions can be implemented as well as they should be, and can deliver as quickly as they might, unless the governance, the workforce, the data, the financing, the monitoring, and that learning, that continuous improvement, that learning and evaluation is part of that local implementation strategy. So from our assessment, we also think that the time is ripe for investment in technical support, and really making sure that the linkages between those action plans are done, work well. Next slide. So while we don't get a universal ranking from smart buys, it does provide a really strong starting point for country-led climate and health investment decisions. It demonstrates health adaptation is investable. Even on these small number of potential actions, we've shown really significant return on investment opportunities. It's demonstrated that context matters more than global ranking. So having a list of best buys is probably not the right way forward, but having an evidence base of candidate actions probably is. And it also shows that it's really important to be able to turn this evidence into action and build capacity for people to look locally at what would work for them. So looking at tools and approaches. And the 2 task teams that we're involved with, we're leading on for this program. One is around smart buys, best buys. We're looking to extend now our reach to cover mitigation, and also to look at those actions that are led by other parts of the system where, but there are significant co-benefits for health. And we're also looking at costing and prioritization methodologies, and we're looking at reviewing what's out there already in terms of technical guidance, frameworks, approaches. Where are there duplicates and overlaps, and what could we perhaps do to rationalize some of that, or at least to provide shine a light for people to find the right framework and tool for them, for their context. I will put a link in the chat to the report. I didn't put a barcode on my slides, and I'm very happy to take any questions. Thank you.
That's really great. There's a lot there, and I think the link to the full report and the evidence that was summarised, and really helpful to see how the smart buys map onto the community, a number of the community of practices that Elena covered. So can I please pass now to Tom? Tom Andrew, will you go next for National University of Singapore? Over to you, Tom.
I will, yes, thank you. So just speaking today on behalf of the task team on measuring GHG emissions in health systems. That's a task team that's co-led by the team inside the WHO, and then also NHS England with my colleague Hitan Patel from NHS England, and then the Centre for Sustainable Medicine at the National University of Singapore. We're going to very, very briefly talk through a big report that we released at COP last year, which we're pretty excited about. But I'll pass over to Hitan to say hello and to introduce the topic first.
Thanks very much, Tom. Yes, thank you. So as Tom said, this is a kind of co-led task team across kind of 3 different organizations. And if we can move on to the next slide, please, I'll talk a little bit about what we kind of were hoping to kind of achieve from this. So from our kind of own context and in the UK and in England, we knew that there wasn't much kind of health relevant kind of guidance on GHG measurement at a health system level, and actually there was a need for kind of clarity and to kind of provide some kind of expertise on what's actually happening in that space. So one of the things we wanted to do kind of by creating the task team and kind of co-leading it was to kind of set out some kind of guidance that we've now published and published at COP30, which Tom will talk about in more detail. But ultimately to kind of start, well, the first part of that guidance, I should say, just kind of start thinking about how do you actually go about measuring the greenhouse gas emissions of a health system? Where do you start? How can you improve? There's a long journey to kind of go on, and kind of getting a better understanding of how we might also be able to think about having consistency between different health systems, so we can learn from each other, but also be able to compare and contrast what each other are doing. So that is what we were aiming for, and that's what we've been hoping to do. I'd like to think we've kind of done kind of part 1 of what we've set out to do, but that wouldn't have been possible without some of our kind of friends and stakeholders and other people that have helped us to get to where we got to. So before Tom talks about the guidance, if you can move us on to the next slide, and I will just want to say thank you to kind of the multiple countries, the Netherlands, Philippines, Thailand, and Australia, that have helped us with kind of country case studies, thinking about what they have done in their own context when it comes to greenhouse gas measurement, and multiple different stakeholders in different countries that have helped us and supported us to kind of draft the guidance, which I will let Tom talk about now. Over to you, Tom.
Thank you very much, Hitan. So the first point of this, I guess, is why measure emissions. So we wanted to set that out in a small contextual thing at the start of this, and I spend my working hours measuring greenhouse gas emissions in health systems. If we can just move on 1 slide. In some ways it's foundational, and in lots of ways, if we truly are going to get to levels of decarbonisation that are consistent with the Paris Agreement and consistent with net zero, we need to be measuring as a healthcare community greenhouse gas emissions in a much more systematic and a much more rigorous way. And frankly, this sector is lagging behind a little bit some of the other major sectors, like you might see in construction or industry or in the power sector. Now, some of that is due to complexity. Health systems are difficult and strange, and we purchase lots of things that are unique to our sector. And some of it is because there's no guidance bespoke and designed for our sector yet. There are lots of things about how to go and do construction of a green office building, but there are very, very few things about how to go and measure greenhouse gas emissions in a healthcare system or in a hospital, which is what we've tried to set out here. So moving on, this is just a very brief infographic of kind of explaining what the heart of the document is. We've set out a maturity framework for measuring greenhouse gas emissions in healthcare. So across a series of dimensions, whether that be the modeling approach, your approach to data collection, indeed the definition of the scope of your health system and how you are measuring it and what emissions and activities within that you are measuring. We've set out a kind of progressive framework for how you might say, well, it's day one as carbon analyst in a Department of Health. Where do I start? Where might I want to get to within 6 to 12 months? That is the first step. It's the exploration stage. It's about taking something where you're starting completely from scratch and saying, well, what are the first big impact things that we can do? And then progressively taking that through a series of levels of maturity through to level 4, which we're calling systemization, which is the point where greenhouse gas emissions start to become regularly reported metrics of health system performance in the same way that that departments of health will measure loads of other data sets within healthcare. Greenhouse gas emissions becomes embedded within those regular reporting cycles. And then also we wanted to display a little bit of a vision for the future of where this field might go as well, which is why we have stage 5, which is frankly a level that no health system in the world is doing right now, but it does set out some directions of where the field might go and where we might see advances in future years. So that's a very, very brief overview of the maturity framework. We'll drop a link to the report. It's also available on this QR code on the side. I do really encourage you to go and read that and read it in detail. It certainly would have been helpful to me when I was starting out in this field a number of years ago. If something like this existed, to just say, what are the first steps that I can do and what does high quality look like? I then have one more slide on the guidance, and then I'll very briefly show an example of it in action. So the other thing that we felt it was important to do here is actually set out a bit of a benchmark for what quality looks like. So within that maturity framework, we highlight 10 key milestones that if you are a high emitting health system or a high ambition health system, you really should be doing your greenhouse gas emissions measurement at this kind of level of maturity and complexity. If you are saying we are taking net zero commitments seriously and we have a clear plan and a mandate to bring them down, and therefore we will be able to measure those emissions coming down over time as we go and implement a net zero plan. So just moving on one more, this is this is not the guidance. This is a report that was published on Friday last week by the Department of Health in the Philippines. And I was, first of all, please go and read it. It's a hugely impressive piece of work led by the department, but also with support from the Asian Development Bank that I think really demonstrates the Department of Health grabbing hold of the concept of measuring health system emissions and doing something about it. It's a pretty quick read, and it's really encouraging to see the Philippines Department of Health using the guidance that we have published and actually integrating that into the report. So just on the next slide, you can see a breakdown of the emissions by scope. That's the pie chart. It looks similar at first glance to lots of health system footprints that we've seen, but there are some unique things about it that come from measuring emissions in a lower middle income context that you don't necessarily see in lots of the studies that might have been published in Western Europe, for example. So there's interesting results that can be gained from there. And importantly, there's a table in that document where the Department of Health sets out how it thinks it stacks up to those key milestones that I showed just a second ago. So I would encourage you all to one, go and read the guidance that we co-developed as a task team, but also please go and look at the work of the Department of Health as well to see it in action. My final slide is about next steps. I'll be very, very quick. We want to do more. We want to use this. We want to make it real. If you are at all interested in the guidance and want to figure out how it could be applied to a project that you are doing, please do come and speak to the task team via the Secretariat. We're also looking to actually take that guidance and make it a little bit more specific and a little bit more precise. We set out the big picture, the kind of overarching framework within which we're working. So the next phases of work for this task team will be much more on a technical level and doing some deep dives into the different elements that are discussed in the main document. And my final point there is a slight call to action. I spend most of my time measuring greenhouse gas emissions in health systems, and I always use these calls as an opportunity to say that doesn't matter, frankly, if we're not doing things to bring down those emissions in the first place. So yes, use the guidance. Yes, go and measure emissions and go and get a pie chart. But more importantly, let's together kind of go and figure out the things that we can do to bring those down in the real world. Thanks very much, everyone. On behalf of the task team, it was great to speak to you today.
That's really great, Tom. Hidden, just so rich, and hopefully people got lots of sort of claps and appreciations. So really practical. Great that there's an opportunity to learn from how others have applied the technical guidance that you've produced. And this is really the sort of spirit of what we're what's hoped with ATACH, which is there's good technical cooperation, and then kind of real world experience of partnering that and then sharing. We've heard from two of the task teams. Of course, there's a huge richness of work, and it's not possible to cover all of it in this slot. But work on early warning systems, from meteorological data, people that are working specifically on the heat subset of issues, on nutrition, on finance. There are communities of practice. There's task teams. There's opportunities to engage. But it's been really great on the World Bank's smart buys and on this measuring emissions in the sector work. Really helpful. We've got some time now for questions or contributions, probably about 15 minutes or so. So does anybody have any specific questions to Tom and Hiten or to Jacqueline on the World Bank's work, or anything else that people would like to come in on? The floor is yours. Maybe as people are thinking, I'd come to Tom and Hiten and say, are there other countries, or which countries are engaged in conversations around taking this forward? Where you mentioned Philippines had published, which others are very kind of active in the space currently?
I suspect between us we're talking to different people at different times for different contexts. But I guess the first thing is to say that I know that dozens of health systems are trying to do this actively at the minute, and we've heard from them as we were developing the guidance. And also there are health systems out there that have published really high quality work before this guidance was published. So obviously there's a need to evolve those two things over time, and we kind of really recognize the fact that this thing was not there a year ago, and therefore you couldn't have known the key milestones necessarily that you were going to tick off within the document. So look, basically anyone who has published a study, basically anyone who would like to publish a study, please do come and speak to us. You know, don't want to name individual health systems, but you know, from across kind of every continent, I've seen good pieces of work on greenhouse gas measurement. From what I've seen so far, from high income countries who are very, very high emitting, and also in lower income contexts who are trying to get on top of their greenhouse gas emissions. So it's really exciting to be in a position where so many countries are trying to do this at once. It's really, really cool. So what we're trying to do is bring a bit of structure and shared understanding and order to that kind of chaos as everyone is learning as they're doing. Anything you wanted to add, Hiten?
And there are two questions in the chat. One is, are there some things which are on the margin of whether it's within the sector or not, like patient transport? How is that handled? And then with more tech and AI and blockchain in the space, are there elements which become increasingly automated?
Well, I can probably take the first one. The blockchain and AI might be a bit beyond what we could get into today. The other thing we tried to build into this thing is flexibility. There are some things that some people will consider to be part of their healthcare system, and others might consider to be part of social care or to be part of the purchasing of paracetamol from a supermarket. Is that part of the healthcare system? Well, it depends on the Department of Health, and you could measure it, and you may choose not to. So we will never have a unified, exactly the same understanding of what a health system constitutes. What we have done is we've said there are some things that really must be considered to be included within a healthcare system if you are going to call it a health system footprint. So things like the upstream emissions embedded in the goods and products that you use within a health system, going and looking at metered dose inhalers or volatile anesthetic gases, things like that. So there is some flexibility within the thing we've set out. We have not set out a ISO level, incredibly detailed 400-page technical standard on how to do a footprint. We've set out what we think is some helpful guidance for the sector and a way of building a shared understanding there.
Thank you. Hidden, do you have a further presentation for this segment, or have your remarks been covered?
I do. I was going to talk about the supply chain task team, if that's okay.
Kevin in Mali and Sean, we'll come to you, but let me first give Hidden the opportunity to cover his presentation. Over to you, Hidden.
Thanks, Leonard. I will keep it very, very brief. So I just want to talk about the kind of decarbonising healthcare supply chain task team. If you move on to the next slide, the task team is kind of co-led by 3 different organisations or bodies. So one part is led by NHS England, another by UNDP, and by ICANN. Today I'm going to be focusing on the part led by NHS England, which is around kind of harmonisation of procurement standards and kind of developing sustainable procurement standards too for a country level. So if we move on to the next slide, the reason that we're focusing on this is, as I'm sure you know, kind of healthcare contributes 5% of global emissions. I won't go too much into that, but around supply chain emissions, roughly are about 60 to 80% of healthcare emissions. I think with the pie chart Tom just had up from the Philippines, that is roughly correct still. So even with the kind of emissions calculations that are happening at the moment, these things are kind of still roughly aligned. We think there's an opportunity, given the nature of healthcare supply chains, which are incredibly international, to think about alignment and kind of collaboration to kind of reduce emissions, reduce costs, improve resilience across the globe, and also can improve health outcomes. And so what we have been doing is working with some of our kind of colleagues, and we take us on to the next slide, to think about setting out kind of some clear guidance on what countries or health systems can do to think about mitigating their supply chain emissions. And there's kind of 2 parts to that, which I'll get into. But in order to kind of learn from from kind of other experiences, we in NHS England kind of worked with our kind of partner organisations to kind of get case studies, get examples, get feedback on what is happening in different parts of the globe, to understand what options there might be to kind of take this work forward with lots of different partners. And at COP30 last year, we published some guidance that I hope someone will pop in the chat, I think, that kind of sets some of that out. But if we move on to the next slide, there's kind of 2 main approaches that we have kind of identified. So the first is around accelerating kind of supplier decarbonisation kind of through procurement, and that is more around kind of the procurement levers that a country might have in terms of asking a country, as we do in the NHS in England, for a carbon reduction plan, or asking kind of countries to think about, or suppliers think about, what they're doing around social value or climate change within a tender. And then the kind of second part is around optimizing demand and usage of supply. So these are thinking about things that are kind of, you know, reducing, reusing, kind of circular economy, and thinking about those other types of actions that countries can take, kind of irrespective in some ways of suppliers, but often actually when it comes to things like reuse, actually needing to work collaboratively with their suppliers. So that is the kind of main approach. And if we move us on to the next slide, we have kind of set a kind of different pathway, similar to how we have in the kind of greenhouse gas emissions path task team, around what countries should be looking to achieve. So a kind of matrix style of kind of the actions that countries should be considering, depending on where they are within their kind of health system performance, and then in terms of low and middle income countries or high income countries should be thinking about things in a slightly different way. And we've kind of tried to set a kind of a matrix or maturity framework of what should be the kind of ultimate goal for countries to think about when it comes to kind of supply chain and procurement. But we have not kind of done this kind of thinking about it without much evidence, and we have kind of what we have tried to do is think about what other people are already doing or the countries are already doing, and use those examples as kind of the things that other countries should also be trying to optimize for. So that is kind of how we have approached this this guidance. And if you move us on to the next slide, please. As I said, there's kind of 4 criterias. There's early stage, mature, core, mature, and advanced. I will kind of move us on to the next slide. I've kind of talked a little bit through that. So here's a kind of example of what kind of optimizing demand and use of supplies might look like. So thinking about, medicines waste or single-use items, and thinking about how you can reduce the use of those, or thinking about how you can maybe think about products that you could reuse, be that gowns or be that other products, metal instruments, that you could think about sterilization, decontamination. And then also there's an opportunity when it comes to optimizing demand, where you can think about choosing alternative products or products with lower emissions. There is, I guess, one thing to say here, which is on the optimizing demand and use of supplies. This is a real opportunity to engage kind of staff. This is an area where kind of clinicians have a real role to play in a way that they might not have such a significant role in other areas of kind of supply chain decarbonization. Here is an opportunity to really engage with staff who are massively engaged in this kind of topic and thinking about climate change and health. So it's a really important area to kind of think about how you might engage them. And if we move us on to the next slide, I'm very conscious of the timeline and I'll be very quick. So the kind of key takeaways is there are actions we think that every health system in the world could start to take, no matter how big or how small. There are opportunities there for countries, and often those actions, when it comes to things like thinking about things like reducing use, don't only offer kind of climate benefits, but also offer financial benefits, reducing cost, improving resilience, and thinking about better health outcomes. Often in some of these examples, there are also examples of procurement criteria and different examples of how that's being applied in different parts of the world, and there's opportunities in different ways in which people can think about doing that. And we're also, I think, important to think about the impact of health systems together, kind of coming together to change the way they think about the goods and services that they want to use, and that is important, and one of the main reasons we think we kind of continued collaboration. And then I think the final point is just to say, we obviously need suppliers as part of this, and we have engaged with suppliers, and I think it's important that we kind of come together to kind of make things simpler for suppliers by having aligned kind of views on how we might approach these kind of issues going forward, especially when we start thinking about things like measurement of kind of products, etc., or emissions profiles of products or life cycle assessments, etc. But that is all from me, Leonard. I'm very conscious of time, so apologies.
I mean, there's a huge richness there. Hidden, you've covered a lot, and it only touches it. There's a lot of lessons, and also there's so many countries who are members of ATACH who have been looking at these areas as well with a lot of their own perspectives and things to share. So we've got a couple of hands. So we've got a slot for Q&A before we move to some of the latter parts of the overall session. Kabine from Mali, and then Sean. Kabine, over to you.
Ok, bonjour. Vous m'entendez?
Oui.
C'est bon, vous m'entendez?
Oui, oui, oui.
Ok, je suis Monsieur Kabinet Doumbia du Mali, je suis le coordonnateur de l'ONG Asrad Mali. Merci pour la présentation, pour cette brillante présentation. Les gaz à effet de serre dans le domaine du système de santé, c'est une première pour moi au niveau de l'Afrique de l'Ouest d'attendre que on peut faire des études par rapport à ça. Donc, est-ce qu'il y a eu des études au niveau de l'Afrique, et plus particulièrement en Afrique de l'Ouest, et dans le Sahel surtout? Si oui, avec quelle organisation, et sinon, comment est-ce qu'on peut réaliser ce genre d'études au niveau du Sahel? Merci.
Thank you, Kabin, and so the more detailed point in the chat, the Secretariat has that, but it's really good to hear from you today. Sean, over to you.
Hey everybody, can you hear me? My microphone's a little bit dodgy, so it might go clicky. So really quick one. I'm based in Wales. We do a lot of work with NHS England anyway. But you mentioned, when the pie chart came up, I could see that medicines was a big chunk, which we see the same in Wales. And then you mentioned inhalers and you mentioned anaesthetic gases. We've done a lot of work in Wales on both of those. And we're now thinking, what next? Was there any intel around are there any specific medicines that you think are the next sort of hot topics that we need to be looking at, or are we more around the process around medicine supply, prescribing, etc., in case we're missing something?
Thanks, Sean. Question to Houghton. Would you like to come back on that?
Yeah, very happy to come back on that. Yeah, I mean, we've thought about kind of desferrine, we've thought about inhalers. We've also done some work on nitrous oxide wastage, which I'm very happy to connect with you outside of this meeting about. In terms of what's next, though, I think that kind of question still kind of does exist. We haven't found the next kind of big thing ticket item. We hope that we will find exactly what that is, but at the moment we don't quite have that. I think though there is, as you kind of point out, an opportunity to think about overprescribing, optimized kind of medicines optimization, and that is a kind of next angle of focus, which kind of delivers the same outcomes. Kind of thinking about reducing usage of medicines which save money. Optimize patient healthcare often, and kind of also fundamentally overall reduce emissions. But yes, unfortunately, we don't have the next big ticket item.
That's great. Thank you. I'm glad we're not missing out on something. So fab. Thank you to reinforce that.
And there's a response or two that's relevant in the chat, Sean, too. And any other questions to any of the presenters, also to the Secretariat around the evaluation or the structure of communities of practice? Do feel free to come through in the chat. So the next thing it will be to pass to Nick. Bear with me. Nick Watts, who is now at the University of Singapore, and what the ATACH partnership has run an evaluation. The co-conveners engage. It has the executive team led by the WHO, and we heard from Rudiger at the start. So there's lots of ideas about the direction that ATACH can go in its operational strategy, but it's a membership organization, and we really want to hear from all those on the call, and there'll be an opportunity to provide some perspectives. But to lead into that, let me pass to Dr. Watts to give an introduction to the operational strategy and thinking for next steps on ATACH and the partnership. Over to you, Nick.
Thanks, mate. Hello, friends. People can hear me, I assume. I always comment on how whoever supplies universities across the world with their furniture must be basically the same. I used to work at UCL, and the background behind me was basically the same as what is behind me. I also used to work at NHS England, and I feel like I recognize that door and that frosted glass and all sorts of things, the lights and the panels. All right, guys, I've got my own slides, if that's okay. Can I wrest control of the sharing and try some of this? Yeah. Looks like it's going to let me without upsetting anyone too much. Okay. You guys can see this. Look, there's like 10 minutes here for me to run through a few slides. It's like 7 slides. They're nice and pretty. I'll be quick, hey, because you've heard quite a lot of what we've been working on. My name is Nick. To the friends I haven't met yet, you can tell my accent is Australian. I'm going to talk a little bit about the ATACH operational strategy for 2026 to 2028. It's something we've been working on just for the last half second since sort of February. God, we're almost now in April. My own background, I'm a doctor from Australia. I've actually sort of had involvement with ATACH in a bunch of different ways, hey, kind of pre-ATACH with things like the Lancet Countdown. I used to hang out with the team for a little while in Geneva. So I have a sense of some of the like data availability that the WHO can bring to bear here with the British government, with the NHS, as almost a member state, soon to be a solid, friendly part of the Department of Health. As a university, and you just heard from Tom and from Hitton on some of the work that we have been doing there on the standards. We got 4 things to talk about, hey? A little bit of context. I'm going to run back through some of the stuff that Elena talked about from the evaluation. I just want to talk for a second about one or two of the things that like stood out to me as worthier consideration as we go forward. Talk a little bit about this operational strategy, some of the headings, some of the timelines, some of the ways to feed in, and then a couple of open questions, hey? So look, let's just situate this for a second. 2022, ATACH burst into existence. It came out of the COP in Glasgow, where there was a frankly unprecedented, pretty exciting burst of energy from health ministries around the world. That obviously wasn't the start of this work, right? This team, many of us have been working on this for a long time since before then, but 2022 is when ATACH sort of bursts out. It refreshes itself in 2024, as we've heard, new governance structure, new work plan going from 24 to 28. We're at the sort of midway point of this, and I just want to situate that that's what's happening, hey? We have a long 4, 5, 6 year strategy for ATACH here. We have sort of a halfway work plan, and we're talking about the next half of that. If I am honest, everything I've done so far to speak to friends, to read through in great detail some of the focus group discussions, nothing here has suggested that the fundamental model of ATACH is broken, right? There are 5, to repeat it, it's worth repeating, 5 core functions that ATACH fills. It's the advocacy and the agenda setting, coming to life at some of those big set piece moments, the World Health Assembly, the UNFCCC processes. There's the promotion of alignment and coherence across different member states. We just heard what that looks like from the supply chain perspective. There's the access to finance, and we'll talk a little bit about that. There's knowledge and capacity building, knowledge generation, capacity building, a little bit of monitoring and tracking. They seem right to me. It's worth resting, though, that it also seems like a lot. I also just want to reiterate, and I know I'm repeating what's already been said. These are numbers from various bits of documents scattered throughout ATACH's history, the WHO's sort of history on this. It is worth repeating that if ATACH fell over tomorrow, if ATACH didn't exist, if we never got our act together back in Glasgow, the very, very first thing we would say is, oh my God, we need something like ATACH. We need something that brings together this community of practice. We need something that helps to promote alignment. We need something that gives us this sense of momentum. Hey, and it's worth being I don't know, stopping and catching our breath and being proud of where we are today. It is really cool. It is for the people that have been in the space for a little while, you would not have got 200 people showing up for one half of a general meeting on this topic before. That wouldn't have happened just a half second ago. You wouldn't have had big ungodly things like the NHS, like health ministries out across the Asia Pacific, where I am already working on this, saying yes, 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 but we want to go faster. So it's worth feeling good about that. It is also worth noting, and get your phone out and pull out your news app. It's also worth noting that the world has changed pretty fundamentally since Glasgow. Okay, we had this like inevitable sense of, momentum back then. I remember it. It felt good. So I felt like we were running off the wave of Paris 2015. The world's a little different now. That sucks. Hey, we can notice that there's a little more conflict. There's a little less belief that we are like better together. And you have to think about that pretty seriously, because in our world, like the core tenets that we trade on, they are that the long term is important as well as the short term. That's everything in climate change. They are also that if we work together, we can overcome something big, right? Like that collaboration, that sense of multilateralism, that is critical to taking on a commons problem like climate change. And so the world's changing. We're facing some pretty serious headwinds. Those headwinds, close your eyes and blink for a second, you will also see between a couple of different countries out across the world a big shift in resource away from development funding. We have to take that seriously. We can ignore it if we want. It's going to smack us in the back of the head if we're not ready for it. So that's the context that we are like entering into this with like great momentum and a huge amount to be proud of, but also a very different world. I hate to be a downer, hey, I kind of feel like the decade from 2015 to today was like the golden era of health and climate change, and we didn't know how good we had it. And we're about to enter into something that's going to be a little bit tougher. So that's okay. We built up momentum, we built up a community, we're ready for that. These are a couple of slides from some pretty painstaking work. You can see 74 national country level respondents, October to January, 24 to 26. A few things I want to draw out here that like kind of stand out to me, hey? Firstly, there is a strange amount of diversity of opinion in the world. If you look at this and you go out and you ask countries, hey, what do you care about? No one breaches 54% in terms of their priorities, 53%. And then once we move beyond mobilizing and supporting access to finance, we drop below 50%. What's happening there is that we've been successful. 104 members, 105 members of ATACH. That's a lot. That's really cool. It also means that we have members that are in very different places. They want different things. They need different things. And it's worth reflecting that some of this stuff, the capacity building and the training, the sort of mobilization, access to finance, facilitation of like direct technical assistance for countries, some of this stuff can function at the global level, but quite a lot of it pretty quickly, when you get good at it, it doesn't function very well there. This stuff becomes hyper-local very, very, very quickly. These 4 boxes here, they're highlighted because I think they take a fair bit more resource capacity than we kind of realize. It's one thing, Hitten knows this, Tom knows this. It's one thing to start with, here's your big global guidance on what a health system needs to do to run its own baseline footprint. It's another thing entirely to go and use that guidance and operationalize it. It's just worth reflecting on this, because I want to talk a little bit about it when we come to some questions. Look, I told you I'd lay out a little bit of a operational strategy set of headings. You can hear from the way I'm talking, I'm a little bit of a cheerleader for ATACH, because like I say, if it wasn't here, my God, the first thing we would need to do is build it back. So I want to make sure that this document, that it properly celebrates the things that we have managed to achieve, properly highlights, draws out member state needs from some of the organizations, and then maybe talks about like 3 different strategic directions under 3 different scenarios, properly transformational, when we sort of double, triple our capacity that we're running at. Something that says, okay, but we've maintained momentum, that's still pretty great. And then something that says, oh, what if we take a hit? You can see on the right-hand side there, some timelines. We've only just started on this. We're somewhere in the middle of, God, I was about to say the middle of March. We're actually at the end of March, eh? We will have a bit of a consultation moment, a bit of a time for discussion in person at the World Health Assembly. If people have comments, thoughts, things they really want to see, really don't want to see, you know the WHO Secretariat, you can get in contact with them. You can also get in contact with me. My email's at the end of this, but I'm on n.watts@nus.edu.sg. And then we're looking to have this thing launched on the 25th of June or thereabouts at this fantastic event in Paris that we heard about at the very, very start. This is my last slide, and then that's enough from me. Two key challenges and 2 questions. The questions, I think we have some Slido moments to take a look at. The key challenges, and I just want to stop and reflect on these. At its heart, what is happening here is we've been too successful. We've been way too successful with 104 countries joining ATACH with all sorts of demands and all sorts of different parts of their journey. There is a demand capacity mismatch. Once you move on from, okay, thank you for the tweet, okay, thank you for the 2-page policy brief, being able to provide that country level support, that stuff gets quite difficult. Elaine has talked a little bit about regional hubs. Cool, really important. But how do we make sure that they are like successful, that they're properly staffed up, frankly, to be able to meet country demand? Some of the WHO regions still have 40, 50, 60 member states inside them. A peer-to-peer system sounds like a great idea. Are we talking about high income to LMIC countries? Or are we talking about high to high so the contexts are similar? Groups of 1, groups of 3? What about some like professional exchanges where we're actually sending staff from the health ministry in Singapore across to, you know, Australia, the Philippines, the UK, where we can learn from each other? What about a country level implementation fund? Now, there's not an enormous amount of funding going around, but what about just enough to start to pilot some of these ideas, to provide some of the countries that put their hand up and can demonstrate they are angrier and hungrier than most? Is that the kind of thing that would like really start to catalyze a little bit of action? What about a market shaping procurement coalition, right? This is where we start to move away from saying that everyone needs to be involved in all 104 of us need to be involved in everything we do. And we can get a little bit more targeted, a little bit more punchy as we go. And finally, in the top right there, challenge number 2, there is a like technical capacity mismatch. There's also an actual resource mismatch. Let's be clear, one of them we count in millions, the other one we count in billions. Yeah. That top right there, there's a really open question. This is something that every member state put their hand up and said, hey, I want help with this. We know there is resource that is starting to mobilize from some of our friends in the multilateral development banks, from some of our friends in the development agencies scattered across the world. What's WHO's role there? I quite like the idea of a dedicated sort of climate finance access team, 2, 3, 4 professionals who are like able to prepare some of that project prep documentation. This stuff is not a 20-page funding proposal. It's a 300-400 page funding proposal to something like the GCF. It takes a year or 2. It is hard, but God, the ROI on something like that, remember we're measuring in the billions, would be enormous. That is enough from me. 2 key questions. We're going to come up to this with a Slido, I think. Let me interpret one of them for you. What is the most important thing that ATACH has done to support your country or organization? Honestly, my answer there, what is your favorite ATACH memory? Mine is in Brasilia last year, where I was feeling pretty down about the world, about the state of climate change and health. And I showed up at the conference and it was full of energy and people talking about what was next. It was the first time in 2025 I felt like our community had momentum. And then the second question here, what's the one most important thing that we really have to do better, that we have to strengthen going forward for 26, 28? That's enough from me. I promise there'd be an email address there. You send me an email, I'll get back to you. I can't promise I'll get back to you soon. Thanks.
Great.
Guys.
Thanks, Nick. That's brilliant. Really strong stuff. Superb. And this is really an opportunity for people to feed into that. The earlier evaluation has gathered lots of views, but this operational strategy work gives a perspective, gives the opportunity for any to feed into ATACH, and that will be really appreciated. So the QR code should be working. If people could go into that, and but we've got a bit of time. There's so many on the call. I wonder whether any representatives from any of the countries who are here, while others are busy filling in the Slido, and then Nick, maybe we'll have a chance to come back to you to just pick up on a couple of things that have come through. But does anybody on any of the areas that we've covered this morning, or anything that you would particularly like to share, those who are member state representatives to the partnership, then you are welcome. And just to recap, we'll aim to finish on the hour, and we'll hear from Dr. Dermot Campbell-Landrum in the Climate, Energy and Air Quality Unit before we finish. But would anybody like to come in? And just to remind, there's lots of different fora, regional opportunities, also through the communities of practice and technical groups. So what's designed with this ATACH partnership is a very sort of multifaceted way for members to engage. Quite a lot in the chat. Nick, I don't know whether you can see those, but there was a question on supply chain and circular economy, a question on institutional memory and how that's... So if there's no representatives or others with their hands up wanting to come in, I'll pass back to you, Nick, for a few minutes, 3 or 4, to respond to those and any digest from the Slido, which is still coming. Back to you, Nick, and then we'll hand to Dermot before 5:02. Nick.
That is fine. I just want to make sure I'm capturing the right set of questions. Is there any plan to involve community-based organizations in monitoring process? Is that what you're talking about?
There was that, and then also somebody asked whether you could expand on your supply chain note on the circular, that one a bit further up.
I'm just
also just back to you, and also whether you've any comment on the process with the strategy work, what timeline to share with partners, and then anything to reflect from the Slido. But just for a couple of minutes, really, because then we'll pass to Dermot before we close.
That's fine. Look, let me expand just for a second on the supply chain side of life. We're all pretty sovereign countries. Hey, healthcare systems don't tend to collaborate on much across borders unless it's providing care with a bit of shared insurance, especially when it's to do with sort of our domestic provision of care. But we do it occasionally. 2 categories that you could imagine doing some of this on. One of those is what about some like basic principles that we start to... I quite liked the document that NHS England produced. Of course I would, I'm a little biased. We start to say, well, who can sign up to some of this? Who can say, yeah, that is the kind of thing I can build into like the foundation of my sustainable procurement strategy for my country. The other half of that is you could get a little bit pointier. You could say, well, look, if just little Singapore puts its hand up and says, I'd like an electric ambulance, or I would like a lower carbon or a circular formulation of this, surgical device. Well, that's not quite the demand that we need. But if 10 of us came together and we all collectively said, yeah, I would purchase that, all of a sudden you find Mercedes, Ford, whoever is making those electric ambulances for us, we've got purchasing power between all of us. I've seen this happen once or twice before. You could imagine on a small number of select products pulling something like that together. I saw another question there around sort of the access to finance. Look, this is tricky because this work is difficult. Anyone that's been involved in developing some of these documents, it's really hard. It is a 1-2 year process. It's often the kind of thing, frankly, that like a McKinsey gets hired for. I'll be honest with you, I don't love that. I would much rather us develop some of that expertise, that sort of health economics expertise, the climate expertise that already exists inside the WHO, and develop that out and provide that as a service out to member states. The challenge there is you couldn't do it for 104 countries. You would need to make sure that you were only doing it for a couple, and that selection process would be difficult. Recommendation 2 suggests a matchmaking mechanism for technical support or criteria would be used to prioritize country requests, make sure they match with partner expertise. Well, that's a great question. I like the idea of something that is slightly less about like country requests and slightly more about a partnership, hey, where you find two countries that are interested in the same topic, and they may either have very, very similar context or very, very different context, but they work together rather than one country asking something of another country. I like the idea of us like using this as a bit of a like genuine peer learning network. We've seen that work well in health ministries out around the world. Look, Leonard, that might be enough from
yeah. I think that's a lot. So we're sort of towards the tail end. There's just scrolling through. There's a huge richness in the contributions and the breadth of participants that are with us, and that can be seen in the chat. One other thing just to mention is we've not talked about it much today, but a big body of work that ATACH really has helped collaboration and move forward has been on vulnerability and vulnerability assessments, and that which feeds into health national adaptation plans. There's been a lot of progress with partners who've supported those and cross feeding of ideas. But with great thanks to everyone who's engaged with that Slido. That's now back with the team. And can I pass to Dermot for your reflections, including on next steps, and then we'll wrap up. Dermot.
Brilliant. Thanks so much, Leonard. Can I first just check you can hear me?
Nice and clear.
Wonderful. Thank you. And thanks so much for the wonderful chairing and bringing us in on time. I'll try not to mess that up in the last 5 minutes. And first off, just a series of thanks. First off, to all of the participants that have joined this really, I would say, really excellent meeting. All of the members of the leads of the task teams that have presented, and also a huge thanks to the very slim secretariat, which keeps this whole ATACH machine running. And I think Elena mentioned it early on in the session. She was touched to see how many people had joined the meeting, and Nick also, I think, alluded to the pride that those of us who are involved in the ATACH feel about the ATACH, because it really has grown from very small origins not that long ago to this beautiful monster, which has over 100 countries, which has presence at the G7, has presence at the World Health Assembly, at COP, and so on, all mainly from I would say the overcommitment of a small number of dedicated people and the kind of community which has joined here. And I think that the strength of the ATACH is also shown not only by that membership, but also the scope that it covers. I don't think there are many meetings that you can go from a question about surveillance in the Sahel from Mali to a question about individual anesthetics in Wales, and both of those actually being on topic within the same meeting. And that really is within the broad scope of what the ATACH covers. And again, with credit to the team behind it, we have a structure that can accommodate all of that. So you may not get the exact answer you may want in the general meeting, but we have task teams, we have community of practice, we have contacts that would actually allow a response to each of these, and that ongoing partnership is incredibly important. And just to quickly reflect as we look forward to some of the environment that we're now working in, and as Nick has alluded to, there are significant challenges to this area of work. ODA in particular is under strain, and ATACH, effectively is supported by a small but important amount of ODA. But the ATACH actually works through leveraging the partnerships and the capacity that come outside. And in this environment, it's so important that we have a machinery that actually doesn't just rely on development assistance, but is actually about working in partnership and leveraging the huge capacity that is out there from the technical agencies, from the countries and so on. And it is all about empowering the countries, not making them reliant on development assistance from outside, but it's a small amount of funding which actually capacitates them and make sure that they're building their ownership and their ability to do things. So we will do our job as the host agency of the ATACH to make sure that we're absolutely as efficient as possible going forward. But just to reiterate that point that Nick has already made, if we didn't have the ATACH, we need to come up with it in order to leverage and build on the capacity that is out there. In terms of looking forward, one of the great things about the ATACH is that we are endlessly adaptable. So that operational strategy that Nick has alluded to, it is a draft operational strategy, and we're very genuine about asking for people's input into it. So that will take shape over the next month or so. We've already got really good suggestions, both from the work that Nick and colleagues have done, but also from our steering group. But we really want to hear from the wider membership as well about exactly what we should be doing as the ATACH to make sure it is on target going forward. And I think we've got really good feedback already. We have this guide on regionalization, this steer on regionalization to bring the work of the ATACH as close as possible to the countries. The matchmaking function, again, when a country needs support, can the ATACH leverage its capacity in order to deliver on that support and so on. But the final word I'd like to leave you on is one that we heard just a minute ago, and that's the importance of partnership, because the ATACH can do a great deal. It is already doing a huge amount in order to drive forward change and to bring together this capacity. Of course, it can't do everything, but what it can do is to find its place or to keep its place, and then also to make connections to others. So whereas the ATACH may not be able to support 100 million or a billion's worth of investment in a particular country, which may be what's actually needed in order to face the scale of the challenge, it can play that function of linking up with some of these other mechanisms, whether it's a Green Climate Fund proposal or an investment from a development bank or a guidance on national resources in order to provide that investment. So that's basically the word that I'd like to leave you with: partnership, and thanks so much for the journey so far. And with that, back to you, Leonard.
Superb. Thanks, Demid, and thanks to yourself and the unit and the ATACH team. It's WHO that's doing a lot of the work behind the scenes to make this happen. So we're at time, so I'd like to thank everyone who presented and everyone who's joined this morning. Thanks all. There's a rerun this afternoon for those with very different time zones, so some may join, particularly the presenters, but with thanks all round, I close the meeting here. Thank you.